What if I told you that some of the most impressive nursing skills are not the loud, dramatic ones you see on TV, but the quiet, precise techniques that can completely change a patient's outcome? Today, we are looking at the most fascinating nursing clinical skills you will wish you mastered sooner. The skills that make nurses faster, safer, calmer under pressure, and honestly, more unstoppable at the bedside. Because nursing is not just about knowing what to do, it is about noticing the small things before they become big things. It is about using your hands, your eyes, and your judgment together, and when those three line up, that is where the real skill resides. Let us start with one of the most iconic nursing skills, starting in Roman 4, which is also called intravenous line insertion. It looks simple from the outside, but good Roman 4 insertion is really about anatomy, timing, and technique. Why is it useful? Because it gives you rapid access for fluids, medications, blood products, and emergency treatment. And the mechanism behind it is straightforward. The closer you are to good vein selection and stable placement, the less trauma you cause to the vessel and the more reliable that line will be. A useful example, a dehydrated patient with poor veins may need warm compresses, gravity positioning, and a calm approach before the attempt even begins. Small adjustments can make the difference between multiple failed sticks and a successful first try. Next, reading vitals like they actually matter, because they do. A skilled nurse does not just record numbers, they interpret them. A blood pressure reading is not just a number on a cuff. It is a signal about circulation, cardiac output, and vascular resistance. That is why a weak, thready pulse, a dropping pressure, and rising heart rate together can tell a much bigger story than any one vital sign alone. Practical use in a patient complaining of dizziness. The difference between a normal reading sitting down and a low reading standing up can reveal orthostatic hypotension, something that might explain falls, fainting, or medication issues. Wound care is one of those skills that looks routine until you realize how much it affects healing. The goal is not just covering a wound, it is protecting tissue, managing moisture, preventing infection, and supporting healthy repair. Mechanism-wise, wounds heal best in the right environment, not too dry, not too wet, clean but not aggressively disrupted. That is why nurses pay attention to drainage, odor, redness, swelling, and tissue appearance. A concrete example, a pressure injury, also called a bed sore, that is caught early may be managed with offloading, repositioning, and skin protection, before it becomes a much bigger problem. Another skill that separates a good nurse from a great one is understanding how to safely manage Roman 4 medications, which are drugs given through an intravenous line. This matters because some drugs must go slowly, some require dilution, and some are incompatible with certain fluids. The mechanism here is simple but critical. The body responds differently depending on concentration, infusion rate, and route. Too fast can mean side effects, irritation, or dangerous reactions. For example, giving a medication through the wrong line or at the wrong rate can cause discomfort, vein damage, or even treatment failure. Knowing drug compatibility and line flushing, which is cleaning the line with fluid, is not just technical, it is protective. If there is one nursing superpower, it is assessment. A skilled assessment can catch deterioration before alarms do. This means observing breathing patterns, skin color, mental status, pain behavior, and subtle changes in speech or movement. The mechanism is pattern recognition. Nurses build a baseline, then spot what is different. For example, a patient who seems fine but becomes slightly confused, more restless, or unusually quiet may be showing early signs of infection, low oxygen, low blood sugar, or medication side effects. That early recognition can change everything. What makes these skills so fascinating is that they are not flashy, they are functional. They save time, reduce complications, and give patients a better experience. They also build confidence. And in nursing, confidence based on competence is one of the most valuable things you can have. So if you are learning nursing skills, do not just aim to get by. Aim to understand the why behind every action. Because once you understand the mechanism, the skill becomes easier to repeat, easier to trust, and much harder to forget. And that is what makes nursing so powerful. A set of clinical skills that can look ordinary until you realize how extraordinary they really are. The most fascinating nursing clinical skills you will wish you mastered sooner is just one small part of clinical skills. If you are interested, our full free clinical skills course is linked in the description.